Hello everyone and welcome to our first topic of Anatomy and Physiology 1. In this lecture presentation, we're going to introduce the concepts of anatomical terminology. Anatomical terminology is one of the cornerstones of anatomy and physiology. It is this presentation that will set your foundation for every other topic in this course. The importance of anatomical terminology gives us a way to speak about the human body in a way that's universally understood. You will come to see throughout your time in anatomy and physiology that the information offered in this presentation will be extremely useful from here on out. As we start to build our understanding of the different words and terms that we'll use in this course, we will use those terms to build up our understanding. So just to serve as a quick reminder, these PowerPoint slides are posted on Canvas under the Module section at the top of each individual module. Just below the PowerPoint slides, you'll see an indented module, and that will contain the lab manual sheets. It is the information presented on the PowerPoint slides, in the lecture recordings, and on the lab manual sheets that you will be tested on in this course. So without any further ado, let's jump into anatomical terminology by getting started with the anatomical position. The anatomical position is a way that we can orient the human body so that we can universally refer to its different parts. It is by using the anatomical position that we can all make sure that we're talking about the body in the same ways. The anatomical position can be described as standing erect with both feet on the ground, face forward, with your arms at either side, and orienting your palms towards the front side of your body. This is a rather natural way for us to view the human body, and I'll go ahead and go to this picture so that you can see what the anatomical position looks like. You can see our model here is oriented in the anatomical position. Feet flat on the ground, about shoulder width apart, arms at the sides with the palms facing forward. You can see from the back side how this looks as well. It is in this anatomical position that we will be referring to the body and all of its different parts. It is good practice that unless I state otherwise on any of the quizzes or tests, to always make sure that you assume that the body is in the anatomical position. The necessity of the anatomical position is it gives us a common reference point so that we can be absolutely positive that we're referring to the different parts of the body in the same orientation. If I was to position myself in the anatomical position and you were to position yourself with your hands over your head instead, we would have two different reference frames to view the body. In the anatomical position, the hands are below the head. However, if you raise your arms above your head, that's going to change the position of your hands relative to the rest of your body. And therefore, there can be some confusion if we're not making sure that we're using this common reference point. So make sure you can describe the anatomical position and you also know what its purpose is. In this presentation, we're going to cover several topics. First, of course, being the anatomical position. We're going to go over a couple vocabulary words, and then we're going to transition into some directional terms. The directional terms are extremely important, and I will use them all the time throughout the course of this class. An example of directional terms are anterior and posterior. Anterior means towards the front of the structure, and posterior means towards the back of the structure. We have directional terms that exist in all different types of planes, and in total we have 5 pairs of directional terms. We will use these directional terms to describe the rest of the anterior and posterior landmarks on the body, to describe the different planes and sections of the human body, and also to discuss the position of different structures relative to others. So if you do capture one thing from this presentation, I want it to be the directional terms. We will jump into these directional terms very shortly, but we have 2 other words that we need to define before we move forward. Our 2 terms of interest are the words auscultate and palpate. These are 2 terms that we'll often use in the clinical setting. To auscultate means to listen, and oftentimes when you go to the doctor's office, the physician will use a stethoscope to listen to your heart and lungs. This is auscultation. Palpation, on the other hand, is to feel, and oftentimes when you go to the physician's office, you'll get your heart rate assessed by palpation of the radial artery. These 2 terms, auscultate and palpate, indicate that we can use more than just our eyes to assess the health of the patient. Incorporating more than one sense is a very useful method in assessing the welfare of the patient. As many of you are likely going on to nursing school, these are terms that you'll likely see in your future careers. So now that we have defined these 2 words, it's time for us to move into the directional terms. Again, there's 5 pairs of directional terms, meaning there are 10 terms that we need to understand. Pairs of directional terms will oppose each other, meaning that as we become more of one term, we become less like its opposing term. We saw earlier with our picture of the anatomical position the terms anterior and posterior. Since anterior means towards the front and posterior means towards the back, as we go more anterior, we're going to naturally become less posterior. We'll review anterior and posterior again in just a second, but we're going to get started with our first set of anatomical terms, superior and inferior. Superior in general means towards the top of a structure, and inferior means towards the bottom of the structure. More generally, superior means above and inferior means below. Now, something doesn't need to be at the top of the structure to be considered superior, and vice versa with inferior. Superior and inferior are relative to each other, and that means that any structure that is above another structure is superior to that structure. Inferior works the same way. Any structure that is below another structure would be inferior to that structure. Let's use a model to describe these terms in a little bit more detail and make sure that we understand these. As we go up the body, we become more superior, and while we go down the body, we become more inferior. So again, a structure doesn't need to be at the top side of the body to be considered superior to something else. One example of this is the knee to the ankle. The knee is above the ankle, so therefore we would say that the knee is superior to the ankle. And at the same time, we could say that the ankle is inferior to the knee. We could also consider the chest. The chest is superior to the knee, and also superior to the ankle, while the knee is only superior to the ankle and inferior to the chest. Any structure that is above or below another structure is considered superior or inferior relative to the structure that we're referring to. So again, another example, if we're referring to the elbow, all of the structures above the elbow are considered superior to the elbow, and all of the structures below the elbow are considered inferior to the elbow. Therefore, the elbow is superior to the wrist, however, it is inferior to the shoulder. So as we become more superior, we become less inferior. These two terms oppose each other, and as one of these terms increases in its meaning, the other decreases in its meaning. One other set of terms that often mean the same thing as superior and inferior are the terms cephalad and caudal. Cephalad's definition means that it's towards the head of the body, and caudal means that it's towards the tail. In terms of the human body, where the head is superior, cephalad can essentially mean exactly the same thing as superior, and caudal would mean exactly the same thing as inferior. However the difference is, superior means more above something else, cephalad means towards the head, and these two terms mean the same thing in the human body because the head of the human happens to be at the top of the structure. So we can say that in the human body, cephalad and superior mean exactly the same thing. However, this will be different for other species. Let's take a dog or a dolphin, for example. The head of a dog or a dolphin is not necessarily considered superior. It would actually be considered more anterior towards the front. Therefore, in those species, cephalad would mean anterior. So while we did not sign up for animal anatomy, we're here for human anatomy, cephalad and caudal will mean exactly the same thing as superior and inferior. But just keep in mind that these two terms do have additional meanings, and they will mean different things in different species. Our next set of directional terms are lateral and medial. Lateral means towards the sides, and medial means towards the midline. So here in this example, we must draw out the midline to show you the difference between lateral and medial. Medial, meaning towards the midline, would refer to any structures that sit close to the midline, and lateral, which is just the opposite, would mean any structure that is far away from the midline. So the further out to the side we go, the more lateral we have become. The closer towards the midline we go, the more medial we become. Using this logic, the nose is a very medial structure, while the eyes will be two lateral structures. But we can also apply the same opposing idea that we saw with superior and inferior. Let's take the ears, the eyes, and the nose for example. The nose is the most medial of those three structures. And while the eyes are considered more lateral than the nose is, the ears are even more lateral than the eyes are. So we would say that the eyes are lateral to the nose, however they are medial to the ears. Lateral and medial also exist within the same plane. And depending on where we're looking in that plane, structures can be considered either medial or lateral. So thus far we have seen two sets of opposing terms, superior and inferior, and medial and lateral. When the body is positioned in the anatomical position and we're viewing the front or back side, it's very straightforward for us to view those planes. Now our third set of opposing terms are anterior and posterior. Anterior means towards the front of a structure, and posterior means towards the back of a structure. We go back to this picture to explain the difference. This is the anterior surface of our body. It's the front side. And this here is the back side of our body, so therefore we refer to it as posterior. Anterior and posterior are also oppositional terms and therefore exist on a spectrum. We'll go ahead and use the chest to explain the difference between anterior and posterior. The thoracic cage made up of the ribs is protecting the heart that can be found nestled away within the thoracic cavity. When considering anterior structures, we would say that the skin of the chest is anterior to the rib bones, while the rib bones are anterior to the heart. However, at the same time, the heart will be anterior to the vertebral column. And if we were to consider the term posterior, everything would reverse. The vertebral column would be posterior to the heart, and the heart would be posterior to the skin of the chest. So the further towards the front we go, the more anterior we get. The further towards the back we go, the more posterior we get. Now some variations of these terms are ventral and dorsal. Ventral oftentimes does mean front, but more specifically, its definition can be described as the belly side of the organism, while dorsal refers to the back side of the organism. Once again, I will state that with the human body, the belly side is pointing towards the front. Therefore, ventral in the human happens to mean the same thing as anterior, and we can use these terms interchangeably in anatomy and physiology. Dorsal, on the other hand, means towards the back of the structure, which just happens to mean posterior in the human body, so we can use those two terms interchangeably as well. However, when we start to look at different species that have a different anatomical structure as the human, ventral and dorsal will mean different things. Again, I don't ever intend to ask you any questions about species other than humans. That's not what we signed up for. But I do want you to be aware of this discrepancy, that ventral and anterior do have different meanings. However, in the human, their meanings align. So now that we've added anterior and posterior to our arsenal of terms, we're going to discuss our second to last group of directional terms, and they are superficial and deep. Superficial and deep gives us a way to refer to something that is found on the outside of the body compared to something that is found nestled very deep within the body. Superficial, as you can imagine, refers to structures that are found on the surface of the body, while the term deep refers to structures that are found beneath the surface of the body or very deep inside the body. So one example that I can give to demonstrate these terms, superficial and deep, we'll use the heart, the thoracic cage, and the skin of the chest to describe these terms. On the surface of the body, we'll find skin. Therefore, it's a very superficial structure. But as we go deeper into the body, we will contact the bones of the thoracic cage. One of these bones is the sternum. Therefore, the sternum is deep to the skin. But we'll also say that the heart is deep to the sternum, as we've already discussed that the heart is found inside of the thoracic cage. Muscles can also be considered deep structures, as they are found beneath the skin. The skin, again, is one of our most superficial structures on the body. However, skin is not the only time we will use the term superficial, as the sternum is considered superficial to the heart. So these two terms refer to how deep or how shallow we are considering going into the body. Our last set of two directional terms are specialized terms, proximal and distal. These are terms that can strictly be used on our extremities, so the arms and the legs. The terms proximal and distal refer to how close or far we are from the point of origin of that extremity. An example of the origin would be the shoulder. The arm originates at the shoulder, and therefore the further up the arm we go, we become more proximal, and the further down the arm we go, the more distal we have become. So you can see that the fingers are very distal structures. The fingers are distal to the wrist, and the wrist is distal to the elbow. However, the elbow is proximal to both the wrist and the fingers, and the wrist is not only proximal to our fingers, but it's distal to the elbow. So the understanding that we need to have about proximal and distal is that the further up the limb you go, the more proximal you become, closer to the point of origin, And the further out you go, or the further down the arm you go, the more distal you have become. So up to this point, we've discussed superior and inferior to refer to above and below. We have discussed anterior and posterior, which refer to the front and the back. We've discussed medial and lateral, which give us a way to compare structures that are out to the side compared to the midline. Superficial and deep, which refers to how far into the body we go, and proximal and distal, which can solely be used on our limbs. We've also discussed cephalad and caudal, and ventral and dorsal, which mean exactly the same things as superior and inferior, and anterior and posterior, respectively. It is these 10 directional terms that we will use for the remainder of our time in anatomy and physiology. In fact, these terms are so important that I'm immediately going to start using them for the next part of this presentation. We're going to now start taking a look at the anterior and posterior landmarks, or regions, that can be found on the human body. We'll first start going over some of our anterior landmarks, and then we'll make our way to our posterior landmarks. Landmarks is one way to put it, but I actually prefer to call these anterior and posterior regions, because these do refer to different regions of the body. Every part of the body gets its own regional name, and we often will name structures based on the region in which they reside within. We'll first start looking at some of our anterior landmarks. One of the things that you'll come to see about our anterior and posterior landmarks is that all of them are named for a particular reason, and we can make associations with these areas that will help us in future classes. In particular, the skeletal system and the muscular system will be much easier if you can have an idea of what these anterior and posterior landmarks are referring to. So let's go ahead and get started from the top down. The first region is the cephalic region, and the cephalic region refers to the head in general. Anything that pertains to the head is considered cephalic, and this goes right along with our other directional term, cephalad. Those sound quite similar, indicating that they mean similar things. We will use the term cephalic when we refer to the head in general, or refer to pathological conditions that relate to the head. One condition in particular that's going to use cephalic in its name is hydrocephalus. Hydro means water, cephalus refers to cephalic. So hydrocephalus is a condition where a child is born with additional fluid accumulating in their head. You'll see that our next term here is buccal. I've also heard this referred to as the buccal region, but buccal I think sounds a bit nicer, so we're going to go with that one. The buccal region refers to the cheek, and this is our first example of a region inside of another region. The buccal region is contained within the cephalic region, and this is not the only place that we'll see this. There are locations all over our body where there will be an overlap in their boundaries. I'll be sure to point out future cases where we see this. Now, as we move down to the neck, not labeled on this slide, but we'll see this with the posterior landmarks, is the cervical region. The neck in general is referred to as the cervical region. Just an FYI, we'll also see a cervical region in the reproductive system of the female. But in this class, when we're talking about a cervical structure, that's going to indicate the neck. Now, as we move down here to this very large orange region, this is going to be referring to a very common and large area of the body. This region in particular is known as the thoracic region, and the thoracic region has many other regions found within it. We call it the thoracic region as it refers to our thorax. Within the thoracic region, we'll also find the sternal region and the axillary region. The sternal region is in particular named because the bone that's found at this part of the chest is called the sternum. So the medial portion of the thoracic region can also be referred to as the sternal region. We also find this unique area here, the axillary region, which can be found in these small boxes over here. The axilla in particular refers to this area lateral to the thorax, which we can more colloquially refer to as the armpit. So the axillary region does look small on this, however, when we move the body and lift the arm, we'll see that the axilla really contains a lot of this area here. Now we skipped over one up here on the top of the shoulder. This is known as the acromial region. This is a term that I don't expect you to have heard about before in the past. The acromial region indicates the top of the shoulder. The reason that we refer to that spot as the acromial region is because we have a bone in this region that has a projection called the acromion process. And when you feel the top of your shoulder, that part of the bone that you're feeling is called the acromion process. This term will come back up when we cover the skeletal system. As we move our way down the arm and enter the upper arm specifically, we call this region the brachial region. Many structures in here are often referred to as brachial structures. One example is the brachial artery. But the brachial artery is just a continuation of another artery known as the axillary artery, which courses through the axilla, and the axillary artery is just a continuation of what's known as the subclavian artery, which comes out over here. So the same vessel courses through the arm and is named based on where it's found. As it passes through the axillary region, it's called the axillary artery, and as it makes its way over here to the brachial region, we call it the brachial artery. We also have two muscles that are found in this region, known as the triceps brachii and the biceps brachii, and we use that location to help identify those muscles in particular. This region will be especially helpful to remember when we get to the muscular system. As we continue to move distally down the arm, we come to the anterior portion that's right in front of the elbow. This area gets a very unique name. We call this the antecubital region, and there is a structure in this region known as the median cubital vein. The median cubital vein will often be the vein that we use to draw blood. The wrist in particular contains 8 bones, known as carpal bones. We call the wrist the carpal region, and we have muscles that attach in this region, and they get carpi as a part of their name to indicate that they attach to the carpal region. One of my favorite regions is the palmar region because it's a very straightforward term to indicate exactly where we're looking. The palm of the hand is referred to as the palmar region. And as we make our way out to the fingers and the toes, those are referred to as digits. So we call those the digital regions. The other anterior structure that we have on this slide is this purple region in here. This is referred to as the abdominal region, as this indicates the space where our abdomen is found. Just as we saw the thoracic region containing other areas, the abdominal region will contain some other areas as well. Specifically the umbilical region, which includes the belly button, also known as the navel or the umbilicus. This is a great example of a region that's found within another region. And we'll see that the pelvic region here is found just below the umbilical region also. Oftentimes we refer to this part of the body as the abdominopelvic region in general. To continue more inferiorly, the 2 hip bones are often called the coxal bones, and therefore these side regions where you can feel the coxal bones can be referred to as the coxal region. As we move more medially from the coxal regions, we enter this gray area. We see that right here, just above the external genitalia, we have the inguinal region. But just for your information, these white lines that are drawn are not perfectly demonstrating the inguinal region. We would more accurately consider the inguinal region to be this entire region here, entirely above the external genitalia. So just keep that in mind. Some of these lines are not perfectly set, and the true areas that these regions include will sometimes overlap with other places as well. The femoral region can be found here. This region is named for the bone that's found coursing from the hip to the knee. That bone is called the femur. So while the femur can be found in this area, we do want to make sure that the inguinal region can be found up here also. As we make our way down the leg, we'll have the patellar region that can be found here at the knee. We call this the patellar region because the bone that we often refer to as the kneecap's true name is known as the patella. Lastly, we'll also have the tarsal region that can be found in the ankle and the pubic region that contains the external genitalia. Now the tarsal region in particular sounds a lot like the carpal region. Just as we had carpal bones in the wrist, we have tarsal bones in the ankle. In particular, there are 7 of these down here. So the wrist is referred to as carpal and the ankle is referred to as tarsal. So one suggestion that I would make for your studies is to take this PowerPoint slide and label all of these regions on your own. We're now going to transition to the posterior landmarks that we see on the back side of the body. Here you can finally see the cervical region labeled. I mentioned this on the anterior side, but as it's now officially labeled on the slides, it's become high yield. If you can remember, the head was referred to as the cephalic region, and it also contained another region on the cheek referred to as the buccal region. But the buccal region is not the only sub-region found within the cephalic region. We also have the occipital area as well. The occipital lobe of the brain is found towards the backside of the brain, and it's covered by what's known as the occipital bone. Therefore, this region can be referred to as the occipital region of the head. Occipital refers to our eyes, and in fact, vision processing takes place in this occipital lobe. As we move further down the body, we see these other posterior landmarks. In particular, you can see this region referred to as the vertebral region. The bones that make up what we colloquially refer to as the spine are called vertebrae, and I prefer to refer to the spine as the vertebral column. There are many different vertebrae that are stacked upon one another, and they can be found coursing down the center of the back in this vertebral region. There are in fact cervical vertebrae that can be found up here, thoracic vertebrae that can be found in this region, and lumbar vertebrae that can be found down here. Lumbar is a term that we use for the lower back. And as this arrow is pointing in this little box here, I want to make sure that you're aware that the lumbar region refers to the entire back. So really, we refer to the lumbar region as everything between these two red lines. It is true that this central region is considered part of the lumbar region and also part of the vertebral region as well. One region we don't want to skip over is the scapular region. The scapula is a triangularly shaped flat bone that can be found here. It is the scapula that contains your shoulder blade, and also the acromion process, which gives us the name for our acromial region here at the top of the shoulder, also comes off of the scapula. The scapula goes down to about here, so we want to keep in mind that these regions above this red line are more so accurately referring to the scapular regions. As we make our way past the lumbar portion of the vertebral region, we also have another bone found here known as the sacrum. The sacrum is a heart-shaped bone upon which the rest of the vertebrae will sit. This bone can be found down here, and it includes your tailbone. The tailbone is specifically a small bone known as the coccyx, and we'll learn more about the sacrum and the coccyx when we get to the skeletal system. Some more specialized regions that we have are the olecramal region, the popliteal region, the perineal region, the calcaneal region, and the plantar region. The olecramal region includes the posterior part of the elbow. This is on the opposite side as the antecubital region. We call this the olecramal region because the bone that's found in this part of the arm is known as the ulna, and it contains a large bone process known as the olecranon process. And it is the olecranon process that's often referred to as the funny bone. Of course, there isn't truly a funny bone in our body, and when we hit the olecranon region, this is very close to a nerve, and the direct stimulation of that nerve is what makes hitting our elbow so painful. We find the popliteal region on the posterior side of the knee, and the perineal region here between the anus and the external genitalia. This region would continue down from the pubic region. And lastly, as we make our way down here to the foot, we have the plantar region and the calcaneal region. Plantar refers to the sole of the foot, and you may have heard of a condition known as plantar fasciitis. Plantar fasciitis is the inflammation of the fascia on the plantar side of the foot, and that can cause a lot of pain when walking. Let's not confuse the plantar region with the calcaneal region. The plantar region more specifically refers to the sole of the foot, while the calcaneal region refers to the heel. The reason that we call the heel the calcaneal region is because the bone that's felt in the heel is called the calcaneus. So once again, I'll encourage you to take this picture to make sure that you feel comfortable with the anterior and posterior regions of the body. We will come to see that we'll use these regions as we go throughout this class to identify different structures and make associations with our bones and muscles. One of the other general concepts that we discuss when we introduce anatomy and physiology are planes and sections. Planes and sections give us a way to slice the body to see the structures that can be found within. Planes and section give us a two-dimensional picture of whatever lines in the plane of that section. But something that we need to keep in mind with planes and sections is that we're trying to view a three-dimensional body in two dimensions. So we need to be cautious of where exactly the body is sectioned and in what plane it sits within. There are three major sections that we need to be aware of. There is the sagittal section that separates the body down the middle, and that gives us a right and a left piece. We have the frontal section, also known as the coronal section, which separates the body into a front and a back piece. And we have a transverse section that will slice the body across and leave us with a top and a bottom piece. So let's elaborate on each of these sections a bit. The sagittal section courses from superior to inferior, and it gives us two lateral pieces of the body. Now we can be a little bit more specific with the sagittal section in particular. We can consider that a sagittal section can be right down the midline. Therefore, we would call that a mid-sagittal section, also known as a median section. This is a section that goes exactly down the midline and therefore would give us a right and left half instead of a right and left piece. All median sections are sagittal sections in fact. However, not all sagittal sections are considered median sections. We could, for example, take this plane and move it towards either side to give us unequal pieces of the right and left side of the body. This example would give us what we know as a parasagittal section, as it's next to the median section. We will also see that we have a frontal section that can also be called a coronal section. The frontal section is oriented 90 degrees from the median section, and this separates the body into a front and a back piece. We will see very shortly a frontal section superimposed onto the body in the anatomical position. And lastly, we'll have the transverse section, which courses across the body transversely. This type of section is especially useful for viewing the muscles in the forearm. Every section in particular is going to be especially useful for viewing different structures. The brain in particular is one structure that we're going to view in the mid-sagittal section. It is this section in particular that gives us a unique way to view the brain that is different than any other way that we can view it. Each section has their perks and allows us to see different structures in a body that is in 3 dimensions. This slide will actually show us an example of a frontal section versus a sagittal section. You can see that this would show us a sagittal section, as we slice the body right down the midline, and we're now looking into the left side of the body. This picture, on the other hand, is showing us a frontal section, where we've sliced off the front of the body and can now see the structures inside. As the lungs are positioned towards either side of the heart, if we want to get a view of all the contents inside of the thoracic cavity, we'd select the frontal section instead. If we were to use a sagittal section, we'd only be able to view one of the lungs or the heart at a time. The last concepts that we'll be discussing in this lecture presentation are the body cavities, the abdominopelvic quadrants, and the abdominopelvic regions. Body cavities can be defined as spaces in the body that contain particular structures. Our body cavities can be grouped into either dorsal cavities or ventral cavities. Remember, dorsal means posterior and ventral means anterior. The dorsal cavities are shown here in yellow. In particular, we have 2 dorsal cavities, namely the cranial cavity and the vertebral canal. The cranial cavity is found up here in the skull and contains the brain. And from the brain, the spinal cord will project out through the vertebral canal, and therefore the vertebral canal in particular contains the spinal cord. As we go through these body cavities, I want you to focus especially on what their contents are. So the cranial and vertebral cavities are considered dorsal body cavities. The cranial cavity contains the brain, and the vertebral canal contains the spinal cord. The dorsal body cavities tend to be a little bit more straightforward than the ventral body cavities. Let's take a second to break these cavities down. Ventral body cavities are found towards the front side of the body. We have the thoracic cavity and the abdominopelvic cavity. And depending on how you look at it, you can separate the abdominopelvic cavity into the abdominal cavity and the pelvic cavity. In particular, the thoracic cavity contains 3 structures, 2 lungs and 1 heart. You can see those spaces shown here. Both of the lungs can be found in the thoracic cavity with the heart right in between. The lungs and the heart are fairly large structures, so they take up most of the space of this cavity. All of these structures sit on a flat muscle known as the diaphragm, which is our muscle of breathing. And it is the diaphragm that separates the thoracic cavity from the abdominal cavity. So the contents of the thoracic cavity were the 2 lungs and the heart. The contents of the abdominal cavity are going to be a little bit more extensive. The abdominal cavity, of course found here where the abdomen is, contains lots of organs of digestions. Some of these organs include the stomach, the liver, the pancreas, the spleen, the gallbladder, the kidneys, the small intestine, and most of the large intestine. Now, I'm well aware that there's quite a bit of contents to remember there about the abdominal cavity. But by process of elimination, we know that the heart and the lungs are found up in the thoracic cavity. And if we can identify what's in the pelvic cavity, we can assume that anything else that I'd ask about on a quiz would be found in the abdominal cavity. So more specifically, the pelvic cavity only contains 3 things. By process of elimination, that can make remembering the structures inside of the abdominal cavity a little bit easier. Inside of the pelvic cavity in particular, we will find the urinary bladder, the internal organs of reproduction, and the last part of the large intestine, specifically called the sigmoid colon. Those are the 3 structures that can be found in the pelvic cavity. And as we've already discussed, the thoracic cavity contains the heart and the 2 lungs. So if I ask about any structure on the quiz that is not found in the thoracic cavity or found in the pelvis, we can assume that that structure would be found inside of the abdominal cavity in particular. so make sure that you're comfortable with the contents of each of these cavities. We're going to briefly introduce the abdominal pelvic quadrants and the abdominal pelvic regions. The abdominal pelvic quadrants tend to be a little bit easier, so we'll go over these ones first. The abdominal pelvic quadrants can easily be separated based on whether they're found on the right side or the left side, and whether they're found on the top or the bottom. The RUQ stands for the right upper quadrant, and the LUQ stands for the left upper quadrant. The RLQ stands for the right lower quadrant, and the LLQ stands for the left lower quadrant. You can see that all we do is draw a cross on the abdominal pelvic cavity. You can see that certain organs can mostly be found in one quadrant. Sometimes they will be found on one of the dividing lines between quadrants, but we can say that the liver here is primarily found in the right upper quadrant. The abdominal pelvic quadrants can be used in particular when you go to the doctor's office. Oftentimes the physician will push on your abdomen, and based on the location of tenderness in the abdomen, that can indicate which organs that pain might be coming from. So while the abdominal pelvic quadrants are quite a simple concept, they're very, very useful clinically. Now we also have the abdominal pelvic regions, which we can see superimposed on this picture here. Instead of drawing a cross, we're going to draw tic-tac-toe. There are 9 different regions here in the abdominal pelvic region. However, one thing I want to assure you is that all of these regions are named rather logically. And based on the particular region we're looking at, we can typically use logic to determine what the name of that region is. So we'll always go ahead and start here at the umbilical region that contains the umbilicus. This would be the center in tic-tac-toe, and this is also my first move right out of the gate. From the umbilical region, we can see on either side the left lumbar region and the right lumbar region. And in fact, these two lumbar regions are actually in line with the lower back. So it would make a lot of sense that we would refer to these as right and left lumbar regions. So using the umbilical region as our reference point, we have the lumbar regions on either side. Superior and inferior to the umbilical region, we'll find our gastric regions, specifically the epigastric region and the hypogastric region. Epi means upon, so the epigastric region is above the umbilical region, and hypo means low. Therefore, the hypogastric region is found below the umbilical region. So we can use little prefixes on our words like these, epi and hypo, to give us some indication about where these regions are found in reference to the umbilical region. The hypogastric region, as we've already seen, can also be referred to as the pubic region. Now, if we consider the hypogastric region, on either side we'll find the right and left inguinal regions. And the inguinal region was found just above the pubic region, right in here. There's a structure right here known as the inguinal canal, and we consider that region when we're looking at these abdominal pelvic regions. We also will refer to these as the iliac regions, as this also includes the coxal region, and one of the bones that makes up the coxal bones is referred to as the ilium. On your quiz, I will probably be referring to these regions as the inguinal regions, so make sure you know these regions by this name. So we're 2/3 of the way done with these abdominal pelvic regions. As we make our way up, we have the epigastric region, and on either side, we'll find the right and left hypochondriac regions. Chondro means cartilage, and we'll find that there is costal cartilage in this area. We'll learn a little bit more about the costal cartilage when we get to the skeletal system. Now, one thing that you might have noticed about this picture is that right and left are on opposite sides. The word right is on the left side of the page, and the word left is on the right side of the page. So you might be wondering, did we make a typo or is this intentional? Fortunately, we didn't screw this up. This is intentional. The reason that the right regions are found on the left side of the page is because we're referring to the reference point of the individual model. This model's right side is found over here. So we account for that when we're looking at the body. This is the model's left side, so therefore we have all of our left structures found over here. If we were looking in the same direction as our patient, our right side would be the same as their right side. However, if the patient is looking back at us, our right side is going to be on the same side as their left side, and vice versa. So just make sure that you're careful with assigning the correct side based on the picture that we're looking at. Now that that explanation is out of the way, we can see that the abdominal pelvic regions can be superimposed on this body, and we will also come to find that our organs can often be found in one of these regions or two of these regions. While these abdominal pelvic regions are not crisply cut between organs, we can consider these lines for each of our organs to indicate the major region that each of these organs is found within. So on the quiz, if you were to be asked which abdominal pelvic region contains the stomach, your answer is going to be the epigastric region. Despite the fact that this does push past the boundary into the left hypochondriac region, the stomach is primarily found in the epigastric region. So for the quiz, I want you to focus on where these lines are indicating each of these organs can be found. So over here in the right hypochondriac region, we'll find the liver and the gallbladder. This organ shown here is the liver, and it's going to play a major role in digestion and also detoxifying poisons from our body. We'll find the gallbladder down here under the liver, and that's going to store bile that will also be used for digestion. The stomach, as I've already mentioned, is found here in the epigastric region, and this is the first place that food goes after it's been swallowed and passed through the esophagus. The stomach will eventually enter into the small intestine, which you can see is very widely dispersed across the abdominal pelvic regions. However, following the logic I've just mentioned, the small intestine is found primarily in the umbilical region. Food escaping the stomach enters into the small intestine to get digested and absorbed. And eventually, after food makes its way through the small intestine, it will enter the large intestine through what is known as the cecum. The cecum is the first part of the large intestine and can be found down here in the right inguinal region. And off of the cecum, we'll find the vermiform appendix sticking off here. The large intestine, also referred to as the colon, has four major parts. We have the ascending colon, the transverse colon, the descending colon, and the sigmoid colon. It is the sigmoid colon which is the last part of the large intestine found within the pelvic cavity. Specifically, the ascending colon is found in the right lumbar region, the transverse colon will also be assigned to our umbilical region, and the descending colon will be found in the left lumbar region. The sigmoid colon truly is found between the left inguinal region and our hypogastric region. While it is found in both of these regions, again, I want you to follow the lines. The urinary bladder can be found here in the hypogastric region as well, and it is from the urinary bladder and the sigmoid colon that we will release waste from the body. The urinary bladder allows urine to flow out through the urethra, and the sigmoid colon eliminates waste through the anus. This picture also shows us a frontal section. While it is a very anterior frontal section, we can see the body structures showing us the lungs, the heart, and all of our organs of digestion in a section that's taken off the front piece. So this, in fact, is a frontal section, also known as a coronal section. The last topic that we'll be discussing in this presentation are a few miscellaneous body cavities. Body cavities can be found all over the body, and again, they're just referring to little spaces. Most cavities will have specific contents that can be found in them, but some body cavities are left empty. Let's take a look at the last remaining body cavities that we'll see. Specifically here is the orbital cavity. These bones around the eye make up what's known as the orbit. As we can imagine, the major contents of the orbital cavities are the eyeballs. Now the nasal cavity is another body cavity, however this cavity tends to be left open. We get another view of the nasal cavity here. There are structures found within the nasal cavity, specifically known as nasal conchae. Those again will become more apparent when we get to the skeletal system. However, there is a natural space that's found in here so that air can make its way back down into the respiratory system. We will also find the oral cavity, which contains the tongue and the salivary glands. This cavity can also be used to bring air back to the respiratory system, but more commonly this cavity is used to ingest food. A less common cavity that we'll also see is the middle ear cavity. There is a small space in each ear known as the middle ear cavity. And in the middle ear cavity, we will find three small bones, specifically the smallest bones in the body. They're called the three ear ossicles, and their names are the malleus, incus, and stapes. Those three bones will need this space so that they can transmit sound back into the inner ear. And also less thought about are our body's synovial cavities. Synovial cavities can be found at synovial joints. Essentially, where two bones come together, there might be a little space containing what's known as synovial fluid that will lubricate certain joints. This allows for bones to more easily slide past each other. We have synovial cavities dispersed throughout the body, and we'll discuss these more when we get to joints. The last body cavity that we're going to discuss is the digestive cavity. Now we often don't think of the digestive cavity as a body cavity, but in fact it is considered a space within the body. Essentially, the digestive system is a long tube that leads from the mouth to the anus, and there has to be a space for food to come in and eventually be digested. Therefore, this is considered one of our body cavities. Anywhere along the digestive system where there's a space for food can be considered a part of the digestive cavity. So anywhere in the mouth, down through the esophagus and into the stomach, through the small intestine and the large intestine could be considered part of the digestive cavity. Again here, the organs shown are the liver and the gallbladder. We see our stomach shown here. The stomach leads into the small intestine, which you can see down in here in the center. And then we'll get into our large intestine, which will be made up of 4 parts: the ascending colon, the transverse colon, the descending colon, and the sigmoid colon. We'll also find the pancreas that can be found behind the stomach. So that will conclude our presentation on anatomical terminology. If you have any questions at all about the material presented in this lecture video, please reach out to me through the inbox on Canvas or through my email posted on the syllabus. If you need any additional assistance, all you need to do is reach out. I will see you all for our next lecture videos that will cover the microscope, the cell, and mitosis.